are you in chronic pain, or maybe you've experienced it in the past and now the pandemic is making things worse? Could it be stress that you should be blaming? We're joined by integrative pain physician Dr. Sheetal DeCaria and author of the book Break the Chronic Pain Cycle. Good morning, doctor. Nice to see you. And I think this is such a relevant topic right now. There's a new report out that finds 8 out of 10 adults are now suffering from significant stress because of chronic pain. Explain what's happening here. Is this kind of just the norm, or are we seeing things worse as a result of this pandemic?
So the stress levels are certainly increasing as a result of the pandemic, and the chronic pain levels are increasing as well. Now, there is a tie, and a lot of times it's missed, and unfortunately we end up not diagnosing it properly and treating it properly.
Okay, so when we say chronic pain, I think everybody has their vision or their idea of what that is, but what kind of symptoms are we talking about?
We're talking about those who are suffering from pain that's been lasting for months. So if it's over 3 or 4 months, it's really interfering with your life and affecting your ability to do your activities of daily living, then it's something to be concerned about.
Okay, when I think of that, then I'm thinking, are we talking backaches, joints, neck aches, migraines? What are we specifically referring to?
There are certain pain conditions that are associated with chronic stress. Some of those are TMJ syndrome, chronic headaches, migraines, neck pain, back pain, bladder pain, and pelvic pain are a lot of the ones we see that are associated with stress specifically.
So how can you tell if it's from stress, and what can you do about it?
So I have a really easy 5-question quiz that people can use. The first question is, are you suffering from those conditions I just mentioned? The second is, in your childhood, did you go through some sort of traumatic event, maybe death of a parent or suffered some form of abuse? And the third is, do you feel like you're anxious or stressed out most of the day? The next question is, have you ever been diagnosed with post-traumatic stress disorder, anxiety, or depression? And the final question is, think about what happened in the weeks or months leading up to your pain. Did you have a very stressful life event? Maybe lost a job, moved, or went through a divorce? And if you answer 1 yes, you may be at risk. 2 yeses, there may be a tie between your stress and chronic pain, but 3 or more yeses, and there's definitely a link between the two. And you need to make sure to address that underlying stress and anxiety, or it's going to be very hard to virtually eliminate your chronic pain.
Okay, that makes total sense. So you have a list of some things that we can do to relieve the pain. Let's put that list up. And I want you to come and walk me through this. What does the first one mean, service?
Sure. So volunteering has been shown in studies to actually make you live longer, stress less, and suffer less chronic pain. Even now, you can look into some virtual volunteer opportunities at local nonprofits here in Chicago, or you can even do something really simple like pick up the phone and check on an elderly neighbor. Even that can really help. And then the second thing is gratitude. Now, living with gratitude can actually reduce cortisol. That's your stress hormone by 23%. So what I say is wake up every morning and take a minute, think of 3 things you're grateful for and write them down. It's going to have a really big impact on your life. And then movement and exercise. We know that's important for mental health and physical health. And right now we're indoors, it's cold, it's winter, and the pandemic is happening, so we're less active than ever before. But you can remain active even indoors without expensive equipment, without a gym membership. Still try to stay active every single day. And then food is medicine. So what we're eating is a direct reflection of kind of how we feel. So studies have shown that raw fruit and vegetables incorporated into your diet instead of processed and packaged foods can actually reduce mental health issues such as depression and anxiety. And usually you'll start to see a difference in 3 or 4 weeks. It's pretty quick.
Okay, so I love your list. If people want to learn more about you and the work that you're doing, where should they go for more information?
Sure, they can visit the website, www.drdecaria.com.
Thank you so much. It's such a pleasure to have you on this morning. We appreciate your time.
Thank you.
Have a great day.
Take care.